The PAOS is coming to Las Vegas this year. Our annual meeting is from September 1st through September 5th.
One workshop I'm especially excited about, an arthroscopic wet lab available to people who sign up early.
For wet lab, we'll be covering shoulder arthroscopy and both the didactic and the hands-on learning experience to perform diagnostic scopes of the shoulder, how to place anchors, perform label repairs, how to place anchors and perform rotator cuff repairs. It's going to be fantastic.
This add-on was made possible by a grant from the PAOS Foundation and Arthrex support. Register for the meeting on PAOS.org. Welcome to the orthoPAC podcast with your hosts Sam Dyer, Chuck Dowell, and Miles Gilbreth. Please join us as we attempt to fill in the gaps between education, current events, and real-world practice. Welcome to today's episode of the orthoPAC, where we spotlight changemakers in healthcare and the trailblazers shaping the future of medicine. With that in mind, today we're honored to welcome Amanda Ben-Simon. Amanda is dedicated to advancing the role of advanced practice providers. She currently serves as the Assistant Director in the Office of Advanced Practice Providers and the Co-Director of the APP Fellowship Program at UT Southwestern Medical Center. Clinically, she's worked in ortho for over a decade and currently specializes in the shoulder. Her passion for professional development and her work through the Office of the Executive Vice President for Health System Affairs has been instrumental in shaping the careers of emerging APPs. Amanda, welcome to the podcast, and let's dive right in.
Yeah, thank you. Grateful to be here.
Amanda, tell us about fellowships. What is a fellowship, and tell us your involvement in the fellowship where you're practicing.
Sure. So I am the APP Fellowship Program Director for UT Southwestern University. And that means that I have the wonderful job of making sure the fellows have a great education. Fellowship, for those unaware, is typically a one-year post-graduation focused education within a subspecialty. And it's truly a pleasure to watch these fellows bloom. A fellowship is certainly not mandatory in many fields. However, it is a great way to get your feet wet and get a lot more focused education in the subspecialty that you really foresee dedicating your career to. In this case, we could say orthopedics. Most of us in PA school, if we had an interest in orthopedics, we had one, maybe two rotations if we were lucky, culminating to potentially 3 months of study, where the fellowship, most of them throughout the nation are 12 months long, and it would be 12 months of fully focused ortho education. So you can imagine there's a big difference between that and on-the-job training.
Yeah, so a fellowship and residency, same thing when we're talking about PAs. Is that correct?
Yeah, some programs call it a residency. I agree. In terms of PAs, I think those two terms could be interchangeable.
Great. And we actually have one of our panel here graduated from a fellowship program. Chuck, what do you think about that? The fellowship programs as opposed to on-the-job training and just kind of learning as you go?
Yeah, I think one of the reasons I chose to do the fellowship coming out of the school was to get more in-depth experience with orthopedics. And I did mine in Chicago at the residency or fellowship they have there. And just to get a broader exposure, I thought for me, it prepared me quite well for on-call and surgical-based stuff. I think the fellowship, when I attended it, didn't have as much clinical-based stuff, so I was a little ill-prepared for that aspect of it. But I assume the credentialing and kind of the programming for the fellowship now encompasses all of that as well. But that was my primary reason for doing it. And I think it did help. I do think, with some orthopedic surgeons, they like to bring young grads in and teach them kind of the way they like to do things and not have bad habits already taught to them. So there definitely is a discussion regarding both ways of entering the orthopedic community. What are your thoughts on that, Amanda? Do you ever hear any of your fellowship trained providers go to practices and have to kind of relearn some things?
I have to admit, Chuck, I'm a bit biased. We look at our fellowship programs throughout the university also as a hiring pipeline. And knock on wood, most of our fellows end up staying within our department and have a full-time position after graduation. So they already know the faculty, the preceptors, the people that they've been working with, and hopefully they've picked up a lot of good habits.
Yeah, I mean, that makes sense. I think if they're working with those physicians on a one-on-one basis during the fellowship, then it's an easy transition. But I definitely think, myself, I've moved to enough practices where each practice I have to learn kind of a different way. Each provider does things, and sometimes some bad habits are hard to unlearn.
So, what's it like doing the fellowship? Are you just doing clinic? Are you doing OR? Is there like a schedule that you follow?
I would say that answer varies based on the program that you're a part of. I can speak to ours in that it is a very fundamental mix of OR as well as clinical practice. We also have structured didactic lectures where the fellows are gone for a half day every week, and our faculty members rotate, giving them through a lecture series. We also have orthopedic residents because I work at a large scale academic medical center. And so the fellows spend a lot of time with the residents, as far as like their tumor indication boards and all the learning that goes on in that sector. So it's a hybrid. You are working full time, certainly. However, it is in an environment in which it's educationally proportionate to where you are in your career as well, because we've all been taught ortho as PAs. It's certainly on our licensure exam. However, this is really the best way to learn all the subspecialties of ortho and get a lot of experience in each one of these subspecialties. We portion out our rotations for 6 weeks at a time. So for 6 weeks, you're working one-on-one with the surgeon, the PA that's a part of that team, the medical assistant, and really focusing on that body part. Then you move on to another 6 weeks later. I must admit, I have some FOMO. I did not complete an orthopedic fellowship. I did on the job training, and I really think I could have condensed the first 3 years of my learning on the job into this fellowship. So you end up in the same place. However, it's a much softer landing straight out of school.
I came along, I'm older than everybody here. And I went to the Connecticut, the thing in New Haven. Do they still have that? I don't even know. But I went there and did like 4 weeks of general surgery and asked if I could do an extra 4 week elective in orthopedics. So I think I kind of did a mini fellowship there. I was with a sports medicine generalist, did a lot of work. I got to go to the clinic. I got to see them, how you did clinic, and I got to go to the OR. So it was definitely worthwhile. Do you think a year is adequate? What's your thinking on that?
I would say nationwide, 12 months is the standard. In order for most of the accreditation agencies, 9 months is the minimum. I don't believe that there's a maximum, but you'll find that most programs are 12 months. I think it's enough. By then, you've been exposed to everything. Most people are really chomping at the bit to start their full-time job and have a full-time salary.
Yeah, I think that's awesome. I know we were sharing personal experience. I am also not a fellowship trained ortho
Mhm.
PA. I was lucky to have a lot of on the job training prior to PA school and worked with a lot of surgeons in my practice after PA school. I work in a private practice in Atlanta. We were in the process of starting a fellowship, and we have had one for the last 3 years. We have about two per year. And I vividly remember being in a PA school interview with two other of my classmates, future classmates, I suppose. And we were asked what we thought about PA residencies. And the two of them both said how they thought they supported it. And I was brutally honest and said, yeah, I do not plan on doing that. Um, Now, having worked with what we call fellows for the last 3 years, I just see how much knowledge they gain in that first year of practice and how much exposure they get to every single subspecialty, and then come out ready to do what they want to do and with the confidence to do it. And so my view of fellowships has completely done a 180 over the last 6 years. And I'm excited now when I get a fellow with me, and I'm happy when I have fellowship graduates to cover my clinic when I'm out. So
I've experienced something similar, Miles. If you speak to some PA programs, their mindset is no, a fellowship or residency is not needed. We train our students to be able to immediately enter the workforce. And I think that's very valid. They also train their students to pass the PANCE, right? That is ultimately what they are going for because these schools are accredited and their PANCE rates are a huge part of their accreditation process. And I agree with you, not to say that there's anything wrong with on-the-job training. I myself experienced it. However, if you want to work smarter and not harder, fellowship is certainly the way to go.
Listeners, check back next week when we continue our conversation with Amanda Ben Simon on PA fellowships and business and leadership questions. I hope to see you guys in Las Vegas. We're really looking forward to a big meeting, and we've got a lot of good stuff going, so please check out our website and check your social media for details. Okay, thanks a lot, and we'll be back next week.